Hi, I'm Dr. Doug Fry at the Center for Manual Medicine and Regenerative Orthopedics. And today we're going to talk about the most common cause of arthritis in the human body, which is actually at the base of the thumb, not your knee or other joints that often get replaced, but even this joint can be replaced. And this is because the stress at this joint is tremendous because the thumb comes across and does what's called opposition across all four of the fingers. So it's getting the pressure of all four fingers right concentrated at this joint. So it becomes degenerative really fast. There's also another joint right below it. This is the metacarpal. This is a carpal bone. So this is the carpal metacarpal joint, or first CMC joint, because it's the thumb, first digit. And this is the scapho. This is the scaphoid bone, trapezium joint. That can be sore also. And this is the radius and radioscaphoid joint. And all three of these joints can be causing pain, but most often it's this one. Sometimes it's two of them, or sometimes it's all three of them. Then there's some tendon conditions. One set of tendons that comes down like this across this joint here that can get a inflammation along the sheath that it runs in, called de Quervain's tenosynovitis. And then there's flexor and extensor tendons that also can get tendonitis, but that's much less common. So we have here today Michelle, and she's volunteered to let us use her hand. And luckily, Michelle has arthritis in her thumb, and you can see that right from there. She's got this nice big swelling, and she's describing pain that comes across like this. So we're going to take our hockey stick, which is a high frequency probe, so that you can see very superficial things, and we're going to start down here. Well, let's do it this way. All right, so here we are. This is the radius. If we come up right there, we come down here, and then we're going to get to the radioscaphoid joint. So right there, and you can see the joint. There's the radial artery pumping. Her joint has a little bit of an osteophyte on it, and if we come back forward again, this is the scaphotrapezium joint right here, and hers still has a little bit of sparring, but nothing terrible. Again, you can see the radial artery on top of it. If we put our power Doppler on, you can see we've got radial artery here. The radial artery actually, as it comes through here, dips down through the bone and comes out on the other side, right there. So you have to be careful when you're injecting in this area to avoid the radial artery. Now we're going to get to the joint of interest, and let's take the power Doppler off. And you can see here that she's got big spurs. First CMC joint, and you can see she's got a big spur on both sides of that joint, and there's a dark area between, which is actually fluid. And if we move the joint, you can see some movement in that fluid, and you can see the tendon moving with it. Okay, if we come down here, this is the tendon that I was talking about that causes de Quervain's tenosynovitis. That's also a common problem with people that have to grasp with a pinch grip, and you get a pain on the side of your thumb in the same area. So you have to determine that from examination, and you can also use the ultrasound to see if the sheath is thickened and inflamed. The extensor tendon coming down here can also be seen right there, and it attaches right up here on the metacarpal. That can get tendonitis and inflammation, and the same on the other side, but this side here. But that's really very rare compared to arthritis in the thumb. So today what we're going to do is help Michelle out. She's having a lot of pain and has been having difficulty even holding on to a glass or a plate or something like that. And we're going to inject the first CMC joint, which is tender. So if I go like that, she says ouch usually. Yeah. Yeah. And if I'm down here, it's not so bad. But if I'm at that radioscaphoid joint, she gets a little bit of pain there too. So we're going to do those two joints. So we're back, and Michelle's ready to get her joints injected. This is the first carpal, metacarpal joint, and I'm going to be injecting right here. And when I do that, I can come this way. That's called in-plane if I've got my ultrasound on top of it this way. Or I can go this way, which is called out of plane. If you go this way in plane, you're going to see the whole needle. If you go this way, you're not going to see anything but a little dot, which is the way I prefer. It's actually more accurate. All right. Our infection rate is very low. We've done about 10,000 injections over the years, and we've had 5 infections. Then that's 5 too many. So I've developed a method, besides scrubbing my hands and putting gloves on, that I call 3 triple scrubs. So we start where we're going to do the injection, and we scrub around a circle concentrically, and we do that with 3 scrubs there. And then we do it again with 3 more scrubs. And everybody gets bored while I'm doing this, but I think it makes a big difference in our infection rate. And there. Now Michelle said she would like to have some numbing medication. So we've got some plain lidocaine right here on a very skinny needle, a 30 gauge. And I can look here and you can see the joint, okay? And I'm gonna put that joint right in the middle there, right? Then I wanna kind of come back and say, oh, there's a little bit of tightness there. If I come down here, move it this way, not so much. So I'm gonna be down here. That'll be a little bit better position. I'm gonna put some numbing medication right in the skin here. And then I'm going to come down, and if you're looking at the ultrasound, you're going to see my needle protrude right there. And I say, okay, we're pretty close to, let's put that there. And that'll be able to numb the capsule, which will make it a little bit more pleasant for Michelle. Okay. Now, we're going to take and use a short needle, and it's a little bit stiffer so that it's very accurate. I'm going to come first above. Can you feel that sharp?
No.
No. Okay. So first I'm going to come above, and you can see, oh, well, I'm right over the joint. So I can back out to the entry point, tilt a little bit, almost, back out, tilt a little more. Oh, we're in the joint there. Okay, so there's the joint, there's the medication. Pull out, and we're done. If you're having trouble with the radial side of your wrist, the base of your thumb, we have all kinds of good techniques to help that beyond just injections. And we'd love to have you come down, get an evaluation, get checked out, and see if we can fix your problem. Call us at 271-8100.